More than 500,000 girls between ages 9 to 14 across Oyo State is expected to benefit from the free Human Papilloma Virus (HPV) vaccination exercise to protect them from HPV infections and consequently from the risk of developing cervical cancer.
This proactive approach will ensure that our girls have a better chance at a healthy future, free from the specter of cervical cancer.
This vaccine is a single dose. Previously, in other countries, they were giving 2 doses, but they have seen that with 1 dose, it is efficacious to cover every girl. And that is why in Nigeria, we're giving the Gardasil vaccine. I think I'd mentioned before that Gardasil was chosen because it provides, long-time protection, greater than 10 years, and also covers, other HPV variants.
For the girls that we have been seeing so far, there has not been any really contraindication to taking the vaccines. But as time goes on, if there's any contraindication, maybe allergy to any of the products used in making the vaccine, then such children may not be given.
While addressing the press on the schedule of the immunization routine, the Oyo State government also noted the need to allay the fears of the people who may have viewed the vaccine in a negative light.
This vaccine has been around with us for over 20 years. Now people have been receiving it, so it's not a new vaccine. The only difference is that it was coming at a cost then. Now it's coming free of charge for people, so that's the only difference there. And people that have been receiving it for over 20 years, nobody has ever reported any adverse event following the addition of this vaccine to us. So we encourage every person to take advantage of this vaccine and help us to protect the future of our younger ones.
HPV vaccine is not a cause of infertility, but rather it's a vaccine that will prevent our girls from having cervical cancer.
To ensure that no girl is left out, templates to accommodate girls in hard-to-reach regions were also provided.
Go to schools, so to as our methodology for reaching the target group, but that does not mean we are leaving those that are out of school. So we're focusing again on special congregations, special area events, whereby we can have girls within that age group. Even in marketplaces, community square, we can go there and be able to congregate them and administer the vaccine.
The vaccine, which has been incorporated into the schedule of routine immunization in all primary health care centers in the state, is targeted towards girls to protect them before potential exposure to the virus identified as a leading cause of cervical cancer, and by extension protect the boy child from also contracting the virus. In Ibadan, Grace Ayonleke.